This rally that we're having today is the first national day of action to say enough is enough. We need national health care now. Very important. They're cutting Medicaid, they're privatizing Medicare, and what they're saying to working people, the people of this country, is you don't have a right for health care, and unless we can make billions on health care, we're not going to provide it. So our first speaker today is Anna Malino. She is a physician, past president of Physicians for National Health Care, and she wanted to build this movement here in San Francisco nationally. So welcome, Anna.
The National Day of Action started as an idea that tried to channel the righteous anger after the shooting of the United Healthcare CEO, Brian Thompson. And this anger was directed not at the shooter, amazingly, but at the victim, because it was against the insurance companies for bankrupting us first and then denying us care later, against corporations for sucking millions of our tax dollars and immiserating our lives. It is natural when we are under attack to go on the defensive. The best defense is a good offense. And that's why we are here today, to go on the offensive, to put single payer on the nation's agenda.
My name is Mark Smith. I'm an occupational therapist, and I'm the president of the National Federation of Federal Employees, Local 1, representing frontline healthcare workers at the Veterans Health Administration here in San Francisco. I'm proud to stand with you all here today in the struggle for a national single-payer healthcare system. At the VA, I see firsthand every day what healthcare looks like when we collectively decide to put patients over profits. While it's not perfect, obviously, no system is, the VA delivers comprehensive, publicly funded healthcare for over 9 million veterans and their families every day. And despite what you might have heard from the corporate media, the care is world-class. Study after study shows that VA-delivered healthcare either matches or outperforms the private sector healthcare in both quality and patient satisfaction, and at significantly lower cost to the taxpayer. Last year, veterans' trust in the VA was the highest it's ever been recorded. But the corporate healthcare industry, our friends over at United Healthcare, and the private equity ghouls who back them, and the politicians that they've bought and paid for, hate this. They hate the VA, this model of publicly funded healthcare, right? Because it's hard to make a profit selling the idea that public healthcare doesn't work when the VA keeps inconveniently proving that public healthcare does work, right? So the corporate class is running the same playbook that with VA that they run with all of our public goods and services. They want to defund VA healthcare by siphoning off resources to the public sector under the guise of choice, right? We've seen this with public education. We've seen this with our postal service. We've seen this with all kinds of public goods and services. And then, they degrade the services, and then they demonize the understaffed and under-resourced facilities as inefficient, all right? This is all with the ultimate goal of dismantling the system so you can sell it off piece by piece for a profit. So why does this matter? Why do we care? What do we lose when we lose VA healthcare as a publicly funded good? Obviously, for the millions of veterans who depend on that healthcare because they couldn't otherwise afford to pay for it, they stand to lose that healthcare. But we also risk losing the public goods and services that VA provides that benefit all Americans. The VA trains thousands of healthcare professionals every single day who then go on to serve civilian communities. 70% of American physicians do at least one rotation at the VA during their training. The VA's publicly funded research program develops treatments that we all benefit from. The implantable pacemaker, the liver transplant, the nicotine patch, the CAT scan, the list goes on. VA has had a hand in many of these innovations that we all benefit from. And many folks don't know this, but the fourth mission of the VA is to back up the civilian healthcare system during times of national emergency. So we saw this most recently with the COVID pandemic. VA provided medical support and emergency services in 38 states during the COVID pandemic. when the private sector healthcare system was overwhelmed. No private system is going to provide all of these functions because they don't generate profits. But most of all, if we lose the VA, we lose one of the best functioning models we have in this country of a publicly funded healthcare system. And we're all here today, presumably because we share the belief that healthcare should serve people and not shareholders. But a belief is not enough. Did working class veterans get publicly funded VA healthcare benefits because they asked nicely? No. Veterans got VA healthcare because they fought tooth and nail for it for decades. So we need to do that as well. We need to fight for the VA. We need to fight for Medicare. We need to fight for Medicaid to defend what we've already got. And we need to fight to expand for Medicare for all, for a national single-payer healthcare system. And we need to fight for healthcare as a human right, for veterans, for workers, for everyone in this country. Thank you. Solidarity.
Thank you.
I'm Harry Breaux, and I'm speaking on behalf of the members and staff of Senior and Disability Action. We do not support any cuts to Medicare or Medicaid and demand that Congress reject these devastating and deadly actions. Nothing good can come from privatizing Medicare and Medicaid. Government's primary responsibility is to protect all its citizens, not just the billionaires. Congressperson Deborah Ross of North Carolina said it this way: this administration should stop violating the Constitution and start taking care of people.
Medicare started under LBJ. It was meant as an insurance system for all people 65 and over and certain people with disabilities. It was a first step. It was only meant to be a first step. It was meant to start a movement to provide improved Medicare for all, And we're still a little behind the times here. But I'm here to say, instead of us getting Medicare for all, we're having Medicare piratized by middlemen who are for profit, who want to extract money out of our Medicare trust fund. And they are overbilling Medicare by and this was in 2020, between 12 and $25 billion. How much do these private for-profit middlemen bilk the Medicare trust fund? The Medicare trust fund has $1,000 billion in it. I had to look up what $1,000 billion is. It's $1 trillion. So there's a lot of money that they can extract out of the Medicare trust fund. That's Medicare Advantage, but of which about 50% of seniors are now enrolled in Medicare Advantage. That leaves about 50% of us who are not, but they're going after us too. It's just too lucrative,
She's a physician. There are many physicians in this country who are fed up with the healthcare system because they want to take care of people. They want to do their job, and they're prevented from doing that by this system, which says that they can't do their job. They have to really make sure that they're making profit from the insurance company.
As a doctor, I envision caring for my patients without the for-profit middlemen who cause delays in treatment, denials of care, and who substitute drugs that I have little faith in. We all deserve better. We are at odds, those middlemen and I. Their purpose as corporations is to make money for shareholders, to keep their stock prices up, and to fund expensive marketing campaigns. To save money, they withhold care, delay care, and deny care. My purpose is to keep you healthy. Their purpose is to keep their company healthy. It has nothing to do with caring for you. Delaying and denying care are not their only tactics. High deductibles and large copays benefit them and discourage people from seeking care. 14 million insured and uninsured Americans have a total of $220 billion of medical debt. The majority have debt over $10,000. And medical debt is the leading cause of personal bankruptcy in this country.
So let's imagine no medical or hospital bills. Imagine no insurance premiums removed from your paychecks. Imagine the burden of providing health insurance lifted from your employer. Imagine being free to leave your job or start a business without the loss of health care for you and your family. Imagine facing a severe medical illness without worrying about medical debt. Our vision is health care for everyone. Our vision is no medical debt. Our vision is no physician burnout from admin loads or moral injury from being forced to practice less than medicine.
We need to have a strategy, a political strategy of independence. I personally worked as a social worker in the emergency room at General Hospital for 18 years. And every day I and my coworkers saw how this system does not work. Many people come into the emergency room with things that they should be seeing their GP, their regular doctor about, but they don't have a GP because they don't have insurance. A really strange system, and one that not only is not economically good for us as individuals, as families, as communities, it's not good for the nation. We spend way more money because we don't take care of people with preventive health care, just keeping people healthy. That's what we should be doing, and that's what single payer would be able to do. That's right. We need to get the for-profit health insurance industry out of the picture. I think our union and other unions must do more to participate in this movement to win single payer.
I'm here today because national single payer is critical. We need single payer health care in the United States, not now, but yesterday. And we need it immediately to help people with medical debt, to help people save money that could be going back into their pockets, but yet gets paid out for insurance premiums and deductibles and so forth. All that money could be going back into people's pockets and covering a lot more. Medicare for all, Medicare itself has a 2% overhead. Regular insurance is 14% overhead. Think about that. The difference is 12%. That's what goes back into people's pockets. So we need to support people. We need to educate our legislators, educate those elected to serve us. And if they're not serving us, we need to get them out of office and replace them with people that will.
Well, this is an example of people in the street. That is what is going to take to make an impression, not only on our legislators, which have to be told what people are thinking, but also for the general public to be educated and understand what is needed to make the change for real healthcare justice in this country.
So the thing that I hope that everybody will come to understand is that we can all have health care by pooling our money together and having one system that encompasses everybody. We can have the kind of health care that people have in other countries. And somebody at our group here made a really good point. He said, while other countries that have universal health care are working to improve the delivery of health care, we here in the United States are really working hard to get everybody access to health care so that then we can improve it for everybody. So that's really important. The money is there. We're just not putting it in the right place, and we're taking money away from health care so that we can put middlemen in the middle to take profits, and then we don't use that money for health care. So it's possible.
So most importantly, what we're trying to do is to build a movement. And that's what I've been saying, that we need to build a movement of millions of people on the streets and in the workplace to force single payer on the nation's agenda. So as I was saying before, we have a bill in Congress and in the House and in the Senate, but it's not enough for our Congresspeople to sign a bill. They need to make this a public fight. And that's why it's going to take millions of us in a movement to force labor unions to make this a public fight, to force members of Congress to make this a public fight. That's what we need, and I think that that's how we're going to achieve single payer, free from profit for everyone.
Watch out.